Okay, so I took the Pharmacology Proctor Assessment a few weeks ago, and I gotta say that it has been the hardest exam I've taken in nursing school. I studied a lot. I did not get the score I wanted to get, but I do have a passing grade. I made it to a level 2, and level 2 and level 3 on these proctor assessments are considered passing. I will explain the levels, and also I will show you what I scored a little later. I will put it here on the screen on the side. And gotta say, I studied a lot. And for those of you that are thinking of going to nursing school, or you're already in nursing school but you haven't taken pharmacology, I encourage you to start studying now. If you have any free time, just start getting familiar with these meds. Go onto YouTube, watch videos on how to study them, because it's a lot. It's a lot of information. And I also want to mention that maybe I did not get the score I wanted to get because there's one important detail, that the school changed our exam last minute, next gen questions. So I think I was just nervous, I was anxious, I did not know what to expect. Anyway, for my school, our percentages for level 1 was a 44%, and that's not considered passing. There will be remediation done for those that scored a level 1. Then for a level 2, it's a 62%, which is kind of low, but it's hard to get there, I gotta say. And then a level 3 is a 76%. It's 25 points, and then with remediation, it's 5 points. Remediation just means for a level 3 and a level 2 that for those categories, just like practice test A and B, wherever we scored a 75%, or lower than 75%, we would have to do those templates. So level 3 is 25 points, and then with remediation, after you turn in all those templates, you get the additional 5 points, and you get a full 30 points. And then level 2 applies to me, which is the maximum you can get is 25 points out of 30. And for level 2 and level 3, there is no retake because it's considered passing. And same thing for this one. The areas wherever we scored 75%, 74% or less, we have to do the templates. So I did get 25 points for this one. And then for the students that scored a level 1, it's 15 points, and then with the template they get 20 points. But for the level 1 and below level 1, remediation consists of a minimum of 3 hours focus review, which is when you open ATI to do those templates, the time is running. Like, it keeps track of your time, so you need to spend 3 hours of studying, which is called a focus review, doing those templates. And we need to make sure that all those 3 hours are running, because if we turn in the report at the end and those 3 hours are not there, we cannot get credit for it. For me, level 2, I forgot to mention, it was a minimum of 2 hours, so I had to do 2 hours of focus review. Besides those templates, for the people that score level 1 and below, they had to do tutoring. So they had to meet with an instructor. So what they had to do in total was the templates, the 3 hour focus review, the tutoring, and they also had to retake the exam. If I remember correctly, if they move from a level 1 to a level 2, they get the additional points, the level 2 points. So now moving on to my score. I barely passed at a 64.2 on the Proctor. I did study a lot. I was expecting a higher score, like I said, and this has been the lowest score I've gotten in nursing school so far. So in a way, I'm glad it's scored by levels and not by percentage, because 64% is terrible for me. Okay, so now what I used, I did not use the book. For pharmacology, the book was not helping me so much. I am a visual learner, and I need to see pictures, watch videos, listen to the information over and over. Repetitive information is key. So what I mainly used, what really helped me a lot since I'm a visual learner, is simplenursing.com. I used their study guides, not the membership, just because it makes it a little easier for me to find the videos that I'm looking for. They do have them on YouTube, but you obviously you have to search for them. Then I also use Nurse Steph's study guide. Her study guide, as you can see, is simple, straight to the point. I love it when I already know the information but I need a refresher. I just read it over and over, and it helps me memorize. But when I'm trying to understand something for the first time, or I just don't get it, I have to watch the videos from Simple, and I can follow along with their study guides. If you have the membership, you can get access to their study guides. Then also I used this study guide from Nurse in the Making. Her study guide is also good. I like it because it's colorful and it has pictures. I started studying about 7 weeks in advance, and I would take the study guides to work, and every time I had downtime or during lunchtime, I would go over it. I actually made a schedule of what topic I was going to study each day. So I would do cardiovascular meds 1 week, and then maybe respiratory meds another week, and then so on. All these study guides are like a summary from the book, and they already did all the work for us pretty much. For me, it was worth it buying all these study guides because, like I said, I work, and just nursing school is very stressful, and I feel that I don't have much time, and taking notes on my own on these medications, it would have been time consuming. And that was just the fastest way for me to have concise information that can really help me out to pass this exam and maybe the NCLEX. So for me, this was more like a focused review because keep in mind that I had already taken this class. So if you're studying pharmacology for the first time, it's a different level of study. But one more thing I almost forgot to mention. During the last 2 weeks of studying before my assessment, I did do some practice questions. We used a system ATI, and they do have this thing called dynamic quizzing. Ask the questions, and the questions are set up very similar to how they ask the questions during the Proctor exam, besides the questions that were from the next gen. Those questions are longer questions. We mainly got a minute per question, but those next gen questions take longer than that, so we did get a little extra time. I can't remember exactly how much time, but depending on how many of those questions we had, it's the time that got extended. And Those questions are a whole scenario. You got to read, you got to go to different tabs, and then try to answer from there, from all that information that you get. Some of them were fill in the blank or multiple choice. It was a full scenario. So you got to be ready for that. That is all I have to say for this video. If you're going to take your proctor assessment soon, good luck to you, and I hope you score a level 3. If this video was helpful to you, please give it a like and subscribe to my channel. I'll see you on the next video.